I'm Marie Pryor and I'm a nurse, but I'm usually employed for Cornwall Partnership Trust as a clinical lead for frailty and ageing. So my background is very much focused on older people and health. When the COVID crisis came in, I was redeployed to the community centre to be a health manager.
So I'm Paula Vondell, I'm the Strategic Manager for East Cornwall Primary Care Network. I think one of the good news stories that's come out of the whole of the COVID experience, if you like, is the fact that the system is really working together in a much more seamless way. So we now are working with our community coordination centres, and the PCN is really supportive of that process because it's enabling all of the resources to come into one place for patients and healthcare professionals to utilise.
So it's great for a patient and for their family because it means that you just have to do one contact, you have to tell your story just one time rather than 6 or 7 times to different people. You're asked what you need, so it's just there, you just tell them your story. And from a clinical point of view, all the things I need to know about that person are available to me. I've now got access to my colleagues across the council, across health. They've got their IT system that we've got access to, so I can get much more ready information about the individual, but also we can do better decision making.
My name's Tina Sanford and I'm a service manager and I work for Cornwall Council. I've worked for Cornwall Council since 2014, so some time, and I've seen a lot of changes in that time. So in my current role, I service manage the east of the county and I report to a head of service, and my role is to make sure that the social work teams working with adults in a community area are delivering assessments and reviews, providing safeguarding responses for people to ensure that their social care needs are met.
I'm Fiona Haggerty. I'm an occupational therapist. I work as the Integrated Community Care Manager for East Cornwall, and within the Community Coordination Centre I am the Healthcare Manager for East. I think the coordination team does exactly what it says on the tin, in that it's matching up the resources we have against what the needs are coming in on a daily basis, and we have a greater flexibility across our staffing and a better oversight of our staffing being in a centralised point alongside our social care colleagues as well. We have a bigger resource available in terms of being much more agile and responding to people in a much more timely fashion.
So the beauty of the community coordination centres are that although the teams are working disparately, they're still very localised services, and the beauty of the system is that it's all pulled together in one place with experienced and highly efficient teams, making sure that people get the right resources they require at the right time in the right place and ultimately closer to home.
I think when people have been through difficult times and they've needed social care involvement or they've needed health involvement to recover from an illness, people want to get better as quickly as possible, and the longer we take to respond and help people develop a plan for recovery, then the longer it is that person's getting back on with their life. So this way of working will enable us to work with people in a much more responsive way, and I'm hoping that we won't have the delays that we have seen in the past in terms of getting to see people, because we do have a significant amount of demand on our services, particularly in the council.
The ability for people to navigate a very complicated system much simpler, and I think this does that. Before, when I'd be working with patients or even as a service user myself, trying to navigate a very complicated health and social care system is enough to drive you to distraction. But now you've literally got one number to go through or one single assessment process to go through, and you can access all the community services you need.